Today we're going to talk about something really, really important to preconception throughout the whole pregnancy journey and postpartum. Our pelvic floors are one of those parts of our bodies that we really don't think about, and yet it's involved in every breath, it's involved in every movement. And it's certainly a large part of a woman's life, containing and helping to house our maybe most essential and private organs, our ovaries, our uterus, our bladders, helping with our bowels, with any of our outputs. It's one of those things that most of us don't think about until there's something wrong. We have a little bit of urine leakage. Pain with sex. Maybe movements aren't as easy anymore. Maybe you noticed you got pregnant and you started to waddle. There's so many things that our pelvic floors are involved in. And so to help you connect, find a comfortable seat, but place a bolster or a blanket or a block, something underneath your bum. So you want to be able to feel your sits bones, your ischial tuberosities, those hard pieces of our bottom, sitting on a surface. Maybe legs out in front of you, legs crossed, spine stacked. And then you should also be able to feel a fleshy part in between the bones. That is the bottom of your pelvic floor. And then bring your hands to the front of your lower belly. And so right where maybe you'd imagine your bladder is, there's a hard bone. It's usually very tender, that's our pubic bone. And then moving up towards the sides, maybe you can feel them right now, maybe you can't. The front of our pelvis. What everyone thinks of is the pelvic bones. And then behind you, the flat part, so basically just above the fleshy parts of your bum, in the middle is a flat part of your back, just above your bum, and that's called the sacrum. So just underneath the sacrum, and sometimes you can feel it if you just tilt forward, there's a hard piece. That is your tailbone. So our coccyx is that tailbone piece. All of this is housing our pelvis, pelvic floor. After feeling for all of those landmarks, maybe getting to know your body a little more, I'd like you to bring your left hand to your heart and your right hand to your belly. If you're growing a belly like me, baby, you cradle it. Maybe your hands just on the front. And just start to notice your breath. Take a deep breath in and sigh it out. And again, deep breath in and sigh it out. As you continue to take these deep breaths, maybe you can imagine your ribs moving. Maybe you want to move your hands to your ribs to actually feel them. Maybe your hands stay the same. But our ribs move out, expand as our diaphragm moves down. Diaphragm is in the front underneath our lungs. So as breath comes in, it pulls down. This is actually only one of 3 diaphragms in the body. It's the one we usually think of. But our pelvic floor is actually another diaphragm. So as you breathe in, you can think of it as your respiratory diaphragm, moves down, and so does your pelvic floor. So maybe on your next inhale, maybe you actually feel that now. Maybe you can feel some sensation in your bottom between your sits bones, where there's just a little more pressure when you breathe in. And if you don't, that's okay, but you can imagine it in your mind's eye. So on the inhale, your respiratory diaphragm and your pelvic floor diaphragm pull down, helping to pull air through your body all the way. So that pelvic floor diaphragm, that's actually where your breath starts. Pulls air down, creating some pressure in your abdomen. And then on the exhale, both of them move up. Now the third diaphragm is actually our glottis, with our kind of above our vocal cords. And we're often a lot more aware of in our throat when we're breathing, because you feel it every time. So same thing. So all of these parts of our body are working together to create breath, to create pressure, to create movement. And now a strong pelvic floor doesn't mean strong in the sense of strength, of tightness, although that's often what ours is like. A pelvic floor that's working properly, that's working with you, has both some tension but can also relax. Just like any muscle part in our body, we need that tension, but it also needs to be able to relax and release. And so part of why we do breath work is to help us connect with that ability to both create some tension and to relax in our bodies. And so instead of it just being out of our awareness, something we don't even know is happening, we actually integrate it into our movements, where we recognize there's both tension, a time for effort, there's also a time to release and soften and for rest. And this is where yoga can really come in handy. Bringing your mind and body into some awareness, into some connection together. To help you believe in yourself, to know that you actually have a lot more control than you realize. To feel empowered in your movements. Maybe they don't look the same anymore. But to know you can do them safely. And you can do them in a way that's specific to your body that feels good. The other part with our pelvic floor is learning how to time it, how to integrate it and create this synergistic activity within your whole body, where your body's working together, not in parts and pieces. I certainly feel that sometimes when it feels like my right leg's not connected to my left hand, that they're separate. And it's really important to remember that we actually can learn how to really connect and coordinate our movements, especially with our breath. And I think maybe one of the biggest pieces of that is of something that I learned in yoga that you can learn in yoga is how to advocate for yourself. How to know that what you feel in class and the things that you're capable of doing in class, you can take outside of the room into the world, because now you have an awareness of your body and what you need. You can ask for it. And for women, connecting with the pelvic floor, this can feel like a very vulnerable space. So bringing that awareness to yourself that this space is actually involved in everything you do. And that normal functioning isn't dysfunction. Normal functioning is actually strong movements that feel good. Pain is just a signal from our bodies that something is off. We've become so accustomed to just living with it and to believing that it's normal, that it's what's supposed to happen. Although really common, pain in our pelvis, our bottom, our lower back, dysfunction with bladder and bowels, sex, isn't normal. And so maybe you just start some connection with your body, awareness with your breath, even just knowing where your pelvic floor is. Maybe that empowers you to ask some more questions. Go to another class, seek out another provider. Or just start to get to know your body more.
Disconnected. Connected to Corey's MacBook Pro 3 and Corey's Phone 3.
The other piece about our body, the awareness, is that, and we talked about it a bit, that our body is actually whole. So our mind and our body are just two pieces, but they're whole. It's meant to be all together. Our mental state, our emotional state, our spiritual state, and our energetic state are also parts of that. So learning how to connect all of those pieces brings you into true wholeness and true empowerment. Take another deep breath in, sigh it out.